I think one of the biggest fears in healthcare right now is the question of, can I eventually be replaced? Maybe by AI, maybe by software, maybe by technology that hasn't even been invented yet, maybe by digital programs. And every time a new technology comes along, people start asking, is this the beginning of the end? I don't think so. In fact, I think this moment is forcing us to answer a much more important question. What actually makes a great vision therapy doctor? Because if we don't know the answer to that, it's easy to believe we're replaceable. If I asked you today, what makes you valuable? I think most doctors would say something like, my experience, my education, my residency, my fellowship, my years in practice. Those things do matter, but I don't think they're actually the answer because none of those things by themselves actually help the patient. Knowledge doesn't change lives. Information doesn't change lives. Exercises don't change lives. Something else does. Think back to your first year practicing, maybe even your first month. Now compare that doctor to the doctor you are today. Are you using completely different equipment? Probably not. Is the lifesaver card different? Nope. Did vectograms suddenly evolve? Maybe there's a few new ones, but we still use the old ones. Did convergence insufficiency become a different diagnosis? No. So what changed? You did. But not because you memorized more exercises. You changed because of something much more difficult to quantify, your judgment. This is what fascinates me. Patients never see your greatest work. They see the activities, they see the office, they see the equipment, they see the therapist. What they don't see is the thousand tiny decisions you're making every single session. Should I progress today? Should I wait another week? Is this suppression? How do we break suppression? Do we want to break suppression? Are they just avoiding it? Is this neglect? Can they really tell if this image is single? Can they tell if it's double? Should I increase the demand? Or are they already overwhelmed? Should I work on accommodation first? Should I work on binocular first? Should I change the order entirely for this particular patient? Patients don't see those decisions. But those decisions are the treatment, not the eccentric circles, not the lifesavers, not the Marson ball, not the heart chart. Those are all the tools. The treatment is your judgment. Here's something I think every vision therapy doctor knows, even if we don't always say it. Two doctors can prescribe the same exact activity to the same exact diagnosis and get completely different outcomes. Why? Because the activity isn't where the expertise lives. The expertise lives in why this activity? Why now? Why today? Why in this order? Why after this activity? Why is this progression for this particular patient? Is this actually unloading for this patient? Is it loading for this patient? Are we building endurance in this exercise or are we building ability? This is where the vision therapy is happening. The equipment doesn't contain the expertise. You do. It's all in your head. People ask me all the time, aren't you worried digital programs are going to replace vision therapy doctors? Of course not. They say, will it replace in office vision therapy? Of course not. They're saying, will it water down vision therapy? Of course not. Because at the end of the day, it's my intellectual property, it's my thought process that people are following just in a way that's accessible for them. Technology cannot create wisdom. Wisdom is earned. It's earned after thousands of evaluations, thousands of patients, thousands of learnings, not mistakes, thousands of breakthroughs, thousands of moments that didn't go according to plan. And in those moments, you had to decide what to do next. That decision, that learning, that change in your methodology That's your expertise. And here's what I think is so beautiful about our profession. Every patient you see has taught you something. Every difficult case changed the way you think. Every conference, every mentor, every article that we've read, every email that we've read on the listservs, every failure has slowly been shaping your methodology. Not someone else's, yours. And one day, without even realizing it, you stopped following someone else's protocol and you started practicing from your own judgment. That's the moment that you became truly valuable. So, if someone asked me today what makes a vision therapy doctor impossible to replace, I wouldn't say it's their equipment or the school that they went to, their office, their credentials, or even their years of experience. I'd say it's their judgment. Because judgment is what allows you to look at two patients with the same diagnosis and realize they don't need the same treatment. It's what allows you to adapt, to pivot, to coach, to sequence, to change things up, to encourage, to know when to push and maybe when to back off a little bit. That's not something you can download. It's not something you can buy. And it's certainly not something eccentric circles can teach. It's your life's work. So protect it. Keep refining it. Keep sharing it. Because I believe that that's the part of vision therapy our profession can never afford to lose. And I also believe that's what makes you irreplaceable. If this conversation resonated with you, I'd love to hear your thoughts in the comments. What do you do that is the most valuable skill you've developed over the course of your career that patients actually never see? If you enjoyed this conversation, subscribe, share the channel with another VT doc, because every year access to vision therapy shrinks while the need for it grows. Let's build the future of vision therapy. Let's get building.